Hi, I'm Dr. Carol DeWalt, and I'm here with Dr. Kathy Williams, dentist, visionary dental arts. And we're here to discuss how does maternal dental care affect infant outcomes, and how can we prepare mothers to have the best dental care as they prepare for the birth of their newborns. Dr. Kathy Williams, it's such a pleasure to have you here today.
Hi, all. As she said, my name is Dr. Kathy Williams. I am a general dentist based in San Diego, California, and also the owner of Visionary Dental Arts, a small private practice in San Diego. And I'm here to talk with you about maternal dental health and how it impacts our babies.
So, Dr. Kathy, can you tell us a little bit about, what types of patients you've seen, where you felt like mothers could have, had more information, how they could uh, better care for their dentistry during pregnancy?
Absolutely. So I typically see mothers postpartum. No one ever comes to the dentist when they're pregnant for some reason, or at the very, very, very end of their pregnancy, when I really can't do anything. I will say that it's important to just keep up with your routine dental visits as far as getting your cleanings done, because that can neglecting that can lead to a lot of problems like low birth weight, premature babies, and tooth loss, cavities, all of the above. I actually did prepare a little slideshow that I'd like to present. If I can share my screen, I can talk about all of my points.
Absolutely. And, as you pull up those slides, I wanted to mention like why I was so passionate about this topic, and I'm so happy you agreed to have this session with us today because I'm a neonatologist and I see babies. And, obviously one of my passions is that babies have the best outcome possible. I feel like a lot of these topics we as mothers do not know what impacts are on our fetuses and on our infants. So, I was surprised to learn during my own birth that, I had some periodontal disease. And I was like, what? I've never had periodontal disease. Like, I love my teeth and I love my dentist. And then I learned that a lot of the things that happen during pregnancy can affect our dental care. So, I hope, we want to learn about that today. What are the changes during pregnancy? And then also, and we'll talk a little bit about infants as well. I think, there's several things that we as mothers don't know how to necessarily prepare our infants' teeth for the best outcomes possible. So it looks like you're ready. Take us away.
All righty. Let me just pull that up there. Am I able to share my screen? One moment. Are you guys able to see that? Okay. All righty. Let me just move this on to the side. Okay. So yeah, we're going to talk about the importance of dental health during and after pregnancy. Okay. So your oral hygiene is important overall. Postpartum, prepartum, during pregnancy, it's important to take care of your oral hygiene as far as your routine visits to the dentist going every 6 months. However, during pregnancy, everything is ameliorated due to the increase of hormonal changes. Okay. We're seeing an increase of progesterone and estrogen. And what that does is it increases the vascularity in the gums. So now during pregnancy, all of a sudden your gums are bleeding. And you may have had the best dental care prior to being pregnant, but your gums are gonna bleed. Most people, when their gums bleed, it hurts. And they're like, I don't want to brush my teeth anymore. I don't want to floss because it bleeds. And that's where the downward spiral comes in. Also, morning sickness contributes to dental issues. A lot of women have hyperemesis or just vomiting in general. Vomit's highly acidic. So that leads to erosion of the enamel, which is the hard layer on our teeth. And beneath that layer is dentin. Dentin is a softer layer. It's exposed when the enamel is eroded, and it's more susceptible to cavities. So women see an increase in periodontal disease and cavities during pregnancy. Another contributing factor is increased cravings. We're craving sweets, we're craving carbohydrates. A lot of us don't realize that. They're like, oh, I don't eat sweets, but eating potato chips, pasta, rice, all of that stuff, carbohydrates, it turns into sugar. You leave that on the teeth, you get cavities. So just keep that in mind, that our diet is contributory to our dental health, as well as our cleanings and routine cleanings with the dentist. Okay, I want to debunk a myth. Again, I don't see a lot of women when they are pregnant. However, postpartum, I see a lot of women and they say, oh, the baby drained the calcium from my teeth and now my teeth are weak. All of the factors that I just mentioned prior to, so, increased hormones, the diet, the vomiting, and not brushing directly after, not flossing directly after. That's what's contributing to the cavities and the weakness of your teeth. If that were the case, if we were losing calcium, it wouldn't be directly from our teeth. You would have bone problems in your fingers and your knees and your hips. So it's not a calcium depletion for the most part, but it is important to, keep up with your calcium uptake. Diet is important during your pregnancy. So eating leafy greens, eating grains and cereal, drinking your milk, that's going to help you with your calcium uptake. But the main fact is periodontal disease due to plaque is causing bone loss and tooth loss in women. Okay, so just to kind of briefly go over what periodontal disease is, it's a disease of the periodontium, which is the tissues in your teeth. So the bone, the gums, and the ligaments that hold the teeth in. Plaque is an irritant, and what plaque is exactly is food. If you leave food on your teeth, regardless if you're pregnant or not, it's going to lead to periodontal disease. Brushing your teeth at night and flossing at night is the most important time to brush and floss, because if you leave that food on your teeth, there's a lower salivary production, and it calcifies the food on your teeth, and that leads to this stuff over here, this plaque that causes the bone loss. The food is an irritant. Your gums in the bone that holds your teeth, and it's gonna run away from that irritant. It doesn't want it in there. And when you're pregnant, your body's defense mechanism is way stronger. Things are ameliorated. So your body does not want that. It wants to protect that life that's growing in you. So you'll get a strong effect of the body attacking itself. Well, the periodontium, not itself. Sorry about that. But periodontal disease can lead to preterm labor and low birth weight. So making sure we are brushing and flossing, especially at night, going to the dentist every 6 months, very, very important. I want to talk about when it is the right time to go and visit your dentist. In the first trimester, a lot of dentists are pretty scared for the most part to see women because they don't want to affect the fetus. So the first 13 weeks, plaque control is important. Getting a cleaning is okay, but more than likely they're going to request a note from your physician because this is a critical growth stage, and we just don't want to cause any issues. So any emergency treatment, we probably request permission from the physician. However, second trimester, it's okay to do some treatment. 14 to 26 weeks, elective and emergency treatments like root canals, cleanings, extractions are okay. I would still hold off on fillings or crowns or anything that's not really necessary. Third trimester is absolutely okay to do treatment, but at this point, it wouldn't affect the fetus, it would affect the mom. So mom being, so big at that point, we don't want to lie you in a supine position for too long. And you're at risk for just, sitting around for way too long. So it's better off that you just, focus on your cleanings, any emergency treatment, and anything that's necessary postpartum is when we do treatment. All right. As far as postpartum challenges, you know, now that you've had the baby, mom's gonna neglect her own health for the health of her baby. Baby's crying, baby's hungry, baby needs diaper changed. Okay. So when will I have time to sit down and brush my teeth or floss my teeth or worry about myself? It's important to still continue your routine dental visits. It's nice to invest in, you know, electric toothbrushes that'll help get the job done a lot quicker, a lot more efficient. My favorite, and I have it on me. Can you see it? The Oral B spin brush. Okay, you can brush your teeth for about 2 minutes with that thing, and you can be the laziest you can. You don't have to brush too hard. You just glaze over your teeth, let it do its job, and then get right back onto your baby. As far as flossing goes, I know a lot of people don't like to floss even when they aren't pregnant. Okay, a recommendation that I have would be floss sticks. And you can kind of be lazy with it. Don't know how easy it is to breastfeed and use your floss pick, but I like to sit down and watch TV and use my floss pick. It's like a bow and arrow. You just go in between every single tooth. Okay, you can again kind of be lazy, let it be in the back of your mind, but you're getting the job done. Okay. Um, Sorry about that. Just want to make sure I have every point made. Okay, so as far as baby teeth development, so about 6 months is when we're going to start seeing some teeth. We're going to see the two lower anterior teeth. But please do not fret if your baby doesn't have teeth by 6 months. Every baby's different. Every baby's growth cycle is different. However, in the first 6 months, we'll see two teeth. You can bring them to the dentist just to check on everything, make sure everything's okay. As far as cleaning goes, we used to recommend a washcloth, like a warm, wet washcloth, and just, you know, wiping the teeth. But mom's fingers are large, the washcloth is large, the baby's mouth is too small. So now we're recommending a cotton gauze that we can just kind of wrap around the finger and just wipe the teeth off. Very important when once your baby starts growing teeth, please do not bottle feed at night. Don't leave milk on the teeth. Maybe switch to water at night, but milk does have sugar in it that causes cavities as well. Okay, so once the baby has teeth, do not let them sleep with a bottle in their mouth. Try to limit that. Any sugars, please limit that because babies can get cavities as well. As far as teething goes, you know, our babies are gonna teeth, they're gonna be in pain. Please do not give them the liquid teething rings because it can burst and who knows what's inside of that, but um, it can be hazardous to your baby. Also, do not apply those topical solutions because the ingredients, we're not really sure what's in it, but it could be harmful for your baby as well. You can freeze a wet wash rag and let the baby bite on it. Basically, anything that's cold is very soothing to the gums. A cool trick that I've seen lately is women are like freezing applesauce and kind of just letting the baby bite down on it and letting it melt in their mouth. And that's pretty fun. I wanted to show you guys a little toothbrush that I've seen. It's not a toothbrush, but oh, where is it? Okay, there it is. Not that one. There he is. So the Frida finger toothbrush, that can help clean baby teeth too. Mom just puts it on the finger, it has little bristles, and you'll just, you know, brush. You don't need to use toothpaste or anything, at least not in the first 6 months. Maybe by the time they're one, wait until they have a full dentition for the most part. So all of their baby teeth, and that's when we start talking about toothpaste. And I just wanted to say, you know, be careful with what's marketed on social media because not all of that stuff, none of it is ADA accepted. A lot of dentists don't recommend it. I've been seeing the auto brush. It's really cute. The marketing is amazing. The kids are like, oh, it glows in the dark, but it's very, very aggressive on the gums. It kind of flosses in between the teeth and it bursts water in the mouth at the same time. Be very careful. Make sure you get professional advice from your dentist prior to buying any of these social media gadgets because most of the time they don't work and they could cause more harm than good. Okay, I think that is. All right, well, that's the end of my presentation. If you have any questions, please feel free to ask away.
So thank you so much. That was amazing. I mean, I learned so much. Like I had not thought about the effects of like vomiting on maternal dentition and um also my baby had bottle mouth or dental caries, bottle caries. And I was so surprised. I felt like, am I a bad mother? And I learned that it was just very important to wash those teeth off after the last bottle. No water until after the first year of life, then we can introduce water as that last feeding or part of it. But I think I would just encourage us to educate our mothers more. I did have a few questions. So what do you feel about the use of xylitol? There were studies that came out recently that demonstrated a significantly decreased incidence of preterm delivery in mothers and periodontal disease in mothers who use xylitol or any type of like sorbitol, xylitol gum, because it decreased, I guess it removed like those cavity forming or those plaque forming particles off the teeth.
As far as that goes, as I don't really know much about like studies in maternal health with xylitol, but um, chewing gum, we always it stimulates saliva. Saliva is a defense mechanism, so that's going to help prevent cavities. However, when it comes to gum, can cause problems as well. TMJ issues. A lot of people that I know who chew gum almost exclusively, they end up having jaw pain.
Mhm.
So just be careful with that, but it does help decrease the incidence of cavities. It does. Just, everything in moderation in life. You don't want to chew too much of it because you're going to cause another issue. So just everything in moderation.
Mhm. I think one of the recommendations was that, no more than 5 pieces a day, which sounds a little bit excessive to me, but like when you're going to eat. But, I think as a neonatologist, especially as an African American neonatologist, African Americans, we have one of the highest preterm delivery rates of any other ethnicity. And that's, very close to my heart. And so one of the questions is whether or not mothers of color should consider, you know, chewing a piece of xylitol a couple times a week, and that obviously this is undergoing, double blinded randomized studies currently, but I know like in Malawi, which also had a similar preterm delivery rate to the African American preterm delivery rate here in America, that had a significantly decreased rate. So I just found that significantly fascinating. I can't wait to see those studies come out. Um, so can you talk a little bit about the relationship between, can mommies give the bacteria in their teeth? Can they pass that to their babies?
Yes. Okay. So there is a study, there's a couple of studies. If mom has cavities or a history of cavities, and they kiss the baby, they can transfer the bacteria strep mutans and the baby can become susceptible to cavities. Does that mean that mom's going to kiss baby and the baby's going to get cavities automatically? No, but now they have, I guess, not the gene, but they have the bacteria for it. So you still have to, regardless who you are, you still have to just make sure you're on top of your dental hygiene and stay away from refined sugars and you're brushing and you're flossing at night and you're going to the dentist. But moms are the carriers of strep mutans and kissing baby, blowing, not blowing food, but putting the food in your mouth prior to putting in the baby's mouth, that's going to transfer cavities as well. But I'm not a mother yet, but I will be kissing my baby when I have one. So I'm not going to say don't kiss your baby, just stay on top of their dental health. Bottom line.
And your health, yeah, I
And
think,
your health.
if we're taking care of our health, we'll help their health.
Hmm.
Um, okay, so I think you mentioned a little bit about periodontal disease, um, and I have a little story. I had a friend who called me and she said her mouth was burning. She was in her second trimester and her mouth was swollen and burning. And, I was in medical school and I had never heard of this as a sign of periodontal disease. Are there any other signs other than bleeding gums? You know, I never heard of burning gums or mouth swelling.
seen some interesting things. Pregnancy hormones are just amazing. I had a friend who had, I guess, an impacted tooth. She didn't know that she had that in there. And the thing just grew in there when she was pregnant. So she had an additional tooth that she didn't know about. And by the time she had the baby, she sent me a photo. She said, I got a new tooth. I'm like, what are you talking about? Wisdom teeth erupt. It's just so many things happen when you're pregnant in your mouth, to your body. Pregnancy tumors are another factor. Pyogenic granuloma. So you'll see like pregnancy tumors on your gum. They're not malignant.
Mhm.
And they do spontaneously involute after you give birth, but sometimes they do have to be surgically removed.
Wow. So what I hear is like, if anything's going on with your mouth, don't rub it off or blow it off or say, oh, I'll do it later.
Yeah,
You
go
know,
to the dentist.
yeah, go to see your doctor. Go to, even if it's just a question and a call. How does
Mhm.
that sound? Yeah. Okay. So when should a baby have their first dental exam? I get asked that a lot.
I would say in the first 6 months when you see teeth. So when they get their little anterior teeth, have the dentist check it out. We won't take x-rays or anything, but we will take a look and make sure um, everything's growing in well. And then by the time they're about 2, they should have a full dentition. And that's when you really introduce them to the dentist, not only to see their teeth, but to get them comfortable. A lot of kids come in later stages in life and they're just not comfortable at the dentist. They are kicking and screaming, and but that I usually refer that to the pediatric dentist. I don't see a lot of children, although I do have a very family-oriented dental practice. So a lot of my patients are like, "Can you just see my baby so that they can just have fun here?" And I'll see them, I'll show them the mirror, I'll show them their teeth, and I'll show them how to brush, and we have a good time. But if there's anything more complex than that, then I refer them to a specialist.
Mhm. Okay, that's awesome. Um, I've also had people concerned about cavities and, say a big word now, meningitis. And I was like, very surprised to find that, I did like a short stint in Peru where a lot of children had poor dentition and we went around putting fluoride on the teeth. And we worked at a maternal clinic in particular. Um, and I guess they were concerned because a lot of the children were having like abscesses and all these things. Is there a relationship between periodontal disease and meningitis? I know that's kind of like an out there question. I think it sounds
I
like
well, from what Mm, meningitis is a kissing disease, right? So,
no, no, no. So meningitis is where you can have an infection of the meninges, like in the brain. It's like a
right,
brain
right.
infection. So, you think about the association, how close everything is here,
Mhm.
everything being like very close in
There's
proximity.
no association between meningitis and periodontal disease. However, I definitely don't have the background to comment on that for the most part, but I know for a fact there's no correlation between periodontal. There's no studies.
That's good.
Yeah, I haven't heard of that.
That we know. If anybody out there knows, you let us know. Um, okay. So as a takeaway point, I let's see if we have any questions. Does anyone have any questions out there? And then we'll go through like our takeaway points. Um, let's see. Okay. So one of the questions is, you know, common concerns are about x-rays during pregnancy. What are the precautions and the risks for x-rays during pregnancy?
Um, so we try our best not to take x-rays unless it's an absolute emergency. Can definitely affect the development of the fetus. So we try not to. However, if you are like having an extreme emergency, if you have really bad tooth pain that we can't get rid of, we will take an x-ray. We'll double up our lead so that we can protect you. But um we really try our best not to take x-rays. Even Duni-Cal in California, our Medicaid has a program where for pregnant women specifically. So basically on a regular day, if you're not pregnant, we have to submit x-rays, we have to submit images, and we have to do what's called periochart and measuring your gums to get a deep cleaning approved, scaling and root planning approved. But if a woman is pregnant, they know that we're not going to take any x-rays. We're just going to do the deep cleaning up to 12 months postpartum. We don't need x-rays or anything. So even like our DentaCal program understands that x-rays can be a detriment, and can affect the development of your baby.
Mm. And then we have a question here. Um, is there association between us consuming a lot of dairy and the ability to minimize dental issues?
No, as I said earlier, like there's a myth that there's a calcium depletion during pregnancy. Um, you still, taking your calcium, but everything in moderation. Some dairy products have sugar in it as well. So you don't want to, drink too much milk, eat too much cheese, leave out all of that in your teeth. Dental hygiene is probably the most important. So brushing and flossing twice a day is the most important, and most helpful way to prevent periodontal disease and going to your dentist. But as far as minimizing dental issues, drinking milk's not going to really help you.
Mm. Oh, so oftentimes when women are pregnant, sometimes they have what we call pre-diabetes or pre-diabetic.
Mhm.
And in pregnancy, due to the hormonal changes, they actually have gestational diabetes. And, what type of changes does that cause for pregnant moms for their dentist?
So that can ameliorate the periodontal disease.
Mm.
So, with diabetes, healing time is delayed. And if you have any irritant in your mouth, like plaque, uh, periodontal disease can be ameliorated. You can lose bone at a rapid rate, um, because healing is delayed. So again, all in all, like hygiene is the most important. Hygiene and diet, not eating refined sugars, not leaving food on your teeth at night, because that's going to contribute to both cavities and periodontal disease. Hygiene, I just can't emphasize it enough. Like that's one thing that you absolutely can get done while you're pregnant. You can get dental cleanings. Make sure you do it, because that's what's going to lead to premature births and low weight babies.
Mhm. Do women ever have increased dental plans during especially, like if you have diabetes, do you increase the treatment plan?
Um, so what I'll say is most people who have dental issues postpartum have had them prior to getting pregnant and
Mhm.
didn't take care of it. And then we have to wait an entire 10 months to actually get the treatment done while all of these hormones are ameliorating the issues. So most women do end up needing more treatment postpartum because we can't or won't do treatment while you're pregnant.
Mhm. So then you have increased treatment. So one thing is if you're trying to get pregnant or, possibly pregnant, it's important to take care of your dentition, even before getting pregnant
Even
then,
before getting pregnant. Yeah.
because you potentially could pass it on to your baby. Huh?
Yeah, that too.
Okay. Well, Dr. Kathy, do you have any other primary points, or do you want to give us like your 5 top tips from Dr. Kathy that we need to put in our pocket?
I can. I see one comment, someone said they love the images. Thank you for that, because I am an AI freak and I used an AI program to create all of these images specifically for Black Maternal Health Week, because it's very difficult to find images for us about us so I can talk about this stuff. And so I spent quite some time creating these images. So thank you very much. But my AI, Microsoft Copilot, it's free, if you have a Microsoft account, or you can create one. But it's totally free. Does Mercury still exist in Philippines? Um, so it depends on where you're going, but amalgam has mercury in it. I specifically don't use it. I use composite. We really are trying to eliminate the use of amalgam and mercury, because not only does it affect people, but it's environmentally a hazard. So we're trying our best to get away from using amalgam. Does it last longer? Yes. Composite is not as tough as amalgam. Amalgam, you can get it 20 years, it'll last you, but composite, that stuff's not going to last for maybe 5 years max. But it is tooth colored, so please don't get upset with your dentist when you say, I had this other filling for 20 years and you just did this one 3 years ago. Why is it not working? It's because the material is just not as advanced anymore. I will say gold was the standard. I am a younger dentist. They didn't teach us anything about gold in dental school. So a lot of the younger dentists are not using gold. Also, the cost of gold just fluctuates. So it's just impossible right now. And fillings and what guidelines are existing fillings for future fillings?
Do you see? I don't see the question.
Does mercury still exist in fillings, and what are the guidelines for existing fillings or future fillings? I think I kind of covered that. Any more questions?
Oh, fluoride. Should we use fluoride-free toothpaste?
Oh, fluoride, yes. Do not use fluoride-free toothpaste. Fluoride is very important. It has an ingredient, has a supplement that restores material in our mouth called hydroxyapatite, so it helps harden our enamel. So if you use fluoride-free toothpaste, you are going to be more prone to cavities. So please use fluoride. And sometimes dentists try to supplement fluoride in the office. I absolutely am for it. I only do it once a year. I don't try to do overkill for the most part, but fluoride is really important to prevent cavities. So yes, please do not use the natural toothpaste without fluoride. Fluoride is really important for your teeth. What's the best toothpaste to use, and what age would you start for the baby? There's so many toothpaste out there. Crest is my favorite, but as long as it has fluoride in it, it's fair game. Colgate's great, Arm & Hammer's great. What age do you start for the baby? I would say about 2 years old, and you put about a pea-size amount of toothpaste, children's toothpaste. Do not use adults' toothpaste, children's toothpaste.
Difference. Yeah. What's the difference?
What's the difference? Has more fluoride in it. You don't want to give the baby too much fluoride because then that leads to fluorosis. And fluorosis is white spots on the teeth. So if your baby has white spots, that means they have too much fluoride. And a lot of our water now is fluoridated. So again, in life, everything in moderation. You don't want too much, you don't want too little.
Excellent. Any other questions from our audience? Wow. Okay. So I have about 15 learning points here. And dental care during pregnancy is okay. Dental care prior to pregnancy is important. Avoid water-filled teething toys. Brush our baby's teeth every day using a finger toy. Get approval from our dentist prior to buying social media products.
Very important.
Avoid leaving teeth on the milk on the teeth at night. No water until after 1 year of age, but rub the teeth off at night after milk. No x-rays are necessary until 12 months postpartum.
Another point I'd like to add for like toddlers, and I know I'm skipping from infants to toddlers, but juice. Juice is a huge, not a no-no, but it's a huge contributory factor to cavities. So you want to just give baby juice in between meals. I'm sorry, not in between meals, with meals, not in between meals. So if they want juice, we're only having it at breakfast, lunch, and dinner, and not beyond, because that's going to contribute to cavities.
Okay. Excellent. And then avoid fluorosis, use children's toothpaste. I think that was one I don't think we had ever really talked about. And begin children's baby's appointment with the appearance of the first tooth. I think that's significant. Excellent. Well, oh, is there another new question? Okay.
What do you advise to, ooh, that is true. What do you advise to parents who notice their toddler's teeth are too close? Too close. It's like they're turning colors.
Well, typically, I mean, this is their first set of teeth, right? And then,
Well,
um,
that is a good question. So primary dentition does grow in with spaces because you need space for the new teeth to erupt. So if they are too close, maybe it's time for us to go to the dentist and potentially the orthodontist. It sounds like there could be a frenulum issue, but I'm not certain. I'd have to see the patient when it comes to that. But teeth are supposed to grow in with spaces. I know our teeth are nice and closed, but baby teeth, when they grow in, we need enough space for the new teeth to grow in. A little too close. And kids don't really need to floss until they have their permanent dentition. So I know it's important to floss, but they have so much space. It's just important to brush. When we're flossing, it's because we have tight contacts and it's getting food from in between our teeth. But when you have a primary dentition, the food's not going to get stuck in between your teeth because there's so much space. So you don't have to floss until I'll say like maybe 10 years old because of how close he's 3. Take him to the dentist. It's time for him to go to the dentist because his teeth should have some space in between. And I think I skipped someone.
when my daughter had to have a spacer put in to hold space and make space and, all those things and move everything around.
Yeah.
Um, and someone asked a little off topic, but it's important. How do we help children with sensory issues to introduce brushing in a way that they can accept when they can't understand the consequences of not brushing yet?
Friends of-
Any tips for helping, maybe
That that
further?
is that is tough, especially for children with sensory issues. I do have a great nephew who is on the spectrum, and we are just having the toughest time trying to communicate that to him. There's not a lot of studies when it comes to that. And a lot more children are on this I don't want to say it like that, but I'm just seeing that like lately, like a lot more children are being diagnosed as on the spectrum. And I'm having a hard time communicating it to children, the importance of their dental hygiene. So I will say I don't really know right now. That's difficult, especially children who are nonverbal and you don't even, they're not communicating with you. You're not really sure if they're understanding like what's going on anyway. That's a tough topic. I'm not certain at the moment, but there are I will say, so I did say earlier that those devices that they market on social media don't get it. But when it comes to children with sensory issues, I think it may work. And I haven't tried it yet. I do not know yet. So actually I'm starting on my social media a little, not a skit, but like I try to say you don't have to. So the things that are being sold on social media, I'm just going to try it out because a lot of dentists are just like, no, no, but you can't knock it until you try it. So I am going to start buying these products and trying it. I recently tried the purple whitening
I
solution.
just thought that too, yeah.
It does
Yeah,
not work.
change
Did you try?
color. Yeah.
It does not work. And I'm gonna post a video on it. It made my teeth like look like I just had some red wine. So, so
Uh,
yeah, I'm just doing it because a lot of patients come in with questions, and I'm like, yeah, yeah. I don't even say don't get it. I say I don't know because I don't know. But I'm gonna try it for my patients so that I can give them the right answer. And
mhm.
we
I
try to.
mean, a lot of those products also cause some sensitivity, so, this is from what I learned. And then as far as neurodiverse children, I think, there's a lot of research being done about how, there's so much research being done. That's why they're becoming more diagnosed, or more frequently diagnosed.
That
And
makes sense. That makes sense. Yeah, but I do have a difficult time as a practitioner communicating that to children. I just want them to get comfortable in the chair for the most part. But I don't see children for the most part either. There's a research and higher increase in diagnosis. I mean that. Oh, okay, that's exactly what she just said. That makes sense. That makes sense. Yeah.
I mean, I agree. I like what you said, making it a fun experience. For me, I love my dentist. I always loved my dentist growing up. I wanted my kids to love my dentist. And my son, or this was a traumatic experience. When he was 5, he had to have 5 extractions, true story. And I cried and I went through the whole spectrum of emotions. And then literally a miracle happened, and my friend, who is a dental rep, she introduced me to a product called the Solara laser.
Oh yeah, yeah, yeah.
And basically, when my son had his extractions, it was like they cracked the tooth and they pull each part out, and it was, bloody, and he's screaming the whole time, even
Oh,
though he was
he didn't.
sedated. It was really hard. And so then, which was completely against my whole goal of loving you guys. And so then we went to Solara. Now my kids cannot wait to go to the dentist. They get balloons and toys, and like, we haven't been to the dentist in 6 months. When are we going? And
Oh, no.
we can't wait to get in that chair. And I think making it fun, and you know, and so they know how important it is, is really important.
I'd love to invest in some laser technology in the future. It is not cheap, and
Mhm.
I am a small Denical practice, so it's really hard to. I had a Solara at one of the offices that I worked at in Del Mar, and I loved it. I'd like to get one in the future.
I mean, it's spectacular. Like, I mean, they walk out with the balloon and smiling 1 hour later and had 5 extractions. No, I'm joking. But no, I'm doing much better now. Mommy fixed her ways. But I think so much is happening in world dentistry. I think, the more we get the message that you just gave us out there, you gave us a wealth of knowledge, I think that will help us, and actually probably help generations to come, because now we're going to pass this on to our children, and, tell all of our friends. All the taboo of dentistry, we need to change that perspective and make it known that it's not just our generation that we're affecting, the future generation by our current care. So, I really appreciate this wonderful knowledge. And just one more run, any more questions or comments from the audience? Let's see. Okay, one more. So what made you go into dentistry, Dr. Kathy, while we wait?
Oh man, I have wanted to be a dentist since I was 16 years old. And the story is not special at all. I couldn't figure out what I wanted to be when I grew up. And I am a very type A kind of person. I need to know, and I have to have a list and I have to follow this list. And the year was 2008. And I wanted to be either a real estate developer or somewhere in the medical field. I was always in science programs, so I was like, I got to be a doctor. I just don't know what kind. The market crashed. I was like, I can't do real estate right now. So I was like, I'm gonna be a dentist. And I
That is
just
a lovely association. Yeah, absolutely.
and I just did a bunch of research. I attended a lot of programs. You know about the SMDEP
Yeah.
programs? I did the SMDEP program in Yale. I shadowed a Black dentist in college on my college campus who actually went to my high school, which was pretty cool. And got into dental school in the first round. The dental school, my first choice. And yeah, everything else has been history. I did my residency at Harbor UCLA, which is used to be called King Drew Hospital, I believe.
Yeah,
The yeah,
Charles
okay.
Drew, yeah, King, MLK.
Charles King, yeah, and historically Black program. And I just learned so much treating a community that needs the help, that wants the help, that's appreciative of the help. And that transferred into how I currently practice. I treat patients in underserved community who want the help, who are very appreciative. We got some donuts today. I just love my patients. Love my patients.
So I went to Charles Drew as well, Charles Drew UCLA. So yeah, I think advocacy and just being community, which is part of why we do what we do as a neonatologist, you know, Black Maternal Health Week is so important for us. This is, I believe, changing the script for our generations. So the question is, they say, I run, which is right in line with what we were saying, I run prenatal and postnatal education with family resources. A lot of our participants are from a lower income demographic. What are ways to help and support dental health in those who cannot afford proper dental care? That's good.
Mm, So what state are you in, Sarah? It varies from state to state. I do see a lot of low income, but most, if not all of them, have some kind of state-based insurance. Um, and I mean, granted, there's a lot of dental clinics, there's a lot of free dental clinics. Will they treat you like a patient? Will they treat you like a number? That's a matter of concern. It's very, very difficult to get, great access to care in underserved neighborhoods. And that's a fight that I'm currently fighting. That's why I built my practice in the community that I built my practice in. But that's a problem that we have been tackling for years, and we're still trying to tackle it. It's difficult. Yeah. Canada.
Hmm. Oh,
Oh,
wow.
wow.
Yay, Canada.
Can Now don't they have free healthcare? But dental is not covered.
Do, but I mean, the waits are really, really long. You can correct me if I'm wrong, Sarah, but I've heard of like 3, 4 month waits for basic.
Sarah, send me an email. Oh, thank you, Mary. Sarah, send me an email. My email address, if I'll just write it down right here. It's drkathywdmd@gmail.com. I have I have two friends who practice in Canada. One's a pediatric dentist, one's a general dentist, and I can get more information from them because I don't really know what goes on in Canada. However, I was supposed to move to Canada 2020, and 2020 happened. So we did not move, and I didn't want to take another board exam. So yeah. Well, thank you, everyone. Thank you for the questions. This has been great. I was actually really, really excited to share this because this is not a topic that's touched. Again, a lot of patients who I see are usually postpartum or at the very end of their pregnancy. Um, and it's not that it's too late, but it's usually like too late. And I'm like, well, we could have taken care of that in the beginning stage. So please, promote this so that we can help others and help get women on track with their dental care.
I mean, Dr. Kathy, I may have to bring you more often. We're going to basically have to educate the pediatricians. We're going to educate OB-GYNs. So my practice, Newborn House Calls, we provide in-home care for moms and babies, and we start in the first trimester all the way through the first month of life. And my goal is through education, the more we know, I feel like the better we do. And I want, we walk with moms, but how do we do that? We do that through OB-GYNs and providers and perinatologists. And so earlier the intervention, I believe the better the outcome. So I'm gonna have to introduce you all over with this talk. Thank you so much, Dr. Kathy, and everyone who joined us today. We really, really appreciate you being here and learning with us today. So,
Thank
bye.
you. much. Bye-bye.